All right. Hi, everyone. Thank you so much for joining us today. We're very happy to have you with us. I'm Gretchen Shaw with the National Coalition Against Domestic Violence. And because the memorial service for George Floyd is happening right now, we'd like to honor that and take just a brief moment of silence, and we will start the presentation directly after that. So as you're logging in, please let's think of him, the struggles of Black country, and how we can all support the efforts. Thank you. All right, thank you all so much. We appreciate you being here today. And again, I just wanted to acknowledge some of the technical issues that we had last week regarding this webinar, so we're very happy to see you all here today. Today's webcast is estimating the impact of domestic violence on local communities in a post-COVID-19 environment. And our presenters today are Carol Wick and Ariadna Parada of Charity Global. So thanks again for being here. And Carol, if you could move on to the next screen, that would be great. So if you could take a minute just to familiarize yourself with your control panel. Today's presentation obviously is being held in Zoom. So here, if you locate your chat bubble at the bottom of the screen, you can chat with other participants. There's also a place where you can raise your hand or ask a question. So do know that we will be answering questions at the end of today's presentation. So any question you have, if you could please enter it into the question box rather than the chat box, we'll certainly be able to address that at the end of the session. Also, you can manage your own audio settings under audio settings. And of course, if you need to leave the meeting early, we certainly understand that. And will not regret it. If you could move on to the next slide, Carol. Also, what's exciting today is we are currently streaming this presentation via Facebook Live on both NCADV's Facebook page and Charity Global's Facebook page. For those of you who are joining us there, thank you so much for your interest. We also will be monitoring all comments or questions there on Facebook, so please feel free to enter it into the chat box there, and we will address it at the end of the session. Carol, if you could forward to the next slide. So please know that this webinar is being recorded, and we will be sending all webinar registrants for this session and last week's session a copy of this recording, a PowerPoint, links to other resources, and then of course a downloadable certificate of attendance. Also, you'll be prompted to complete a short survey at the end of the presentation, and then again in the email that follows. Please be sure to fill that out because your feedback is incredibly important to us. All right, if you can move on to the next slide. So typically NCADV offers webinars only to its NCADV members and then paid registrants, but because of COVID, we are doing our best to make as much as possible related to COVID-19 free and accessible to you. But of course, we're able to do that because of your generous support. So we encourage you to check out our membership offerings and become a member if you're able and interested, or consider donating to NCADV. All information can be found via ncadv.org. If you get forward to the next slide. Additionally, because of the overwhelming information that is out and available now regarding COVID-19 and domestic violence, NCADV has created its own page on our website related to those resources in COVID-19. So via ncadv.org/COVID-19 and domestic violence, you can find resources, connect with us here at NCADV, get legislative updates and action alerts, and then link to more information, webinars specifically, and other trainings related to domestic violence and COVID-19, and then also read, listen, watch any media coverage related to the topic. Good. Forward, Carol, to the next slide. And this year is another conference year for NCADV, so we will be hosting our 19th National Conference on Domestic Violence, Recognizing Your Power, October 25th through 28th in St. Louis, Missouri. So the conference is happening regardless of location. We'll be making a final decision here within the next month or so, whether it will be held completely in person, part virtual, or totally virtual. So if you're on our email list, you'll certainly get that information as it comes out. Also, we have extended our proposal submission deadline to June 12th. So if you're interested in having a workshop or a session considered for a presentation during our conference, please go to our website to fill out that information, register if you're interested, and learn more. All right, if you could please forward. And if you are someone who tweets, please use the hashtag #AdvoChat or hashtag NCADV to tweet about today's session. All right, so now I'd like to take a minute to introduce our incredible presenters. Again, the title of this is Estimating the Impact of Domestic Violence on Local Communities in a Post-COVID-19 Environment. Today's presenters are Carol Wick and Ariadna Parada with Charity Global. So Carol Wick has advised nonprofits her entire career and understands its unique challenges. First as a therapist for abused children, and later as an award-winning CEO of one of the nation's largest domestic violence centers. She's since formed Charity, a global consulting firm with a mission to empower nonprofits to take control of their future and their fundraising. Her team is comprised of experienced nonprofit experts who bring decades of wisdom and experience to every project. Building on her exceptional 30-year track record of nonprofit management, community advocacy, and fundraising, Carol developed a model to assist nonprofits in assessing their ability to get to the next level. She is recognized as a foremost expert at turning around struggling organizations, using her business acumen to achieve financial stability, and her advocacy to engage the community as partners. Ariadna Parada is a recent graduate with a passion for service. She uses her position in Charity Global to shed light into social, cultural, and economic disparities. She enjoys building relationships so that individuals in our communities become motivated to help each other and help decrease inequalities around us. So I will now turn the presentation over to Carol and Ariadna. Again, we'll be watching your questions come through the question and answer box as well as the chat. So we hope you enjoy this, and thank you very much.
Thank you, Gretchen. And I want to just really thank the team at NCADV. I know last week we had some technical difficulties, but Gretchen and everybody has been so great. And the team at Charity Global is using our Zoom channel, and for the first time for me too, being able to broadcast this live so that as many people as possible can watch this. And I really, really appreciate NCADV giving these webinars at no charge during this time. And it's amazing because from just last week, the world has shifted yet again. I think there were a lot of us that thought things couldn't get a whole lot crazier after COVID. And now we have a modern civil rights movement underway that is, I think, consuming a lot of our energy and our attention. And at this time right now specifically as we're memorializing George Floyd, it's a difficult time, and we're angry and we're grieving. And for those of us in this movement in particular, we started building this presentation around the idea of responding to COVID, but we all know about the police brutality that happens, not just in the street, but in the homes. And we know that this pandemic that we just are still in the midst of, that we are now recognizing other pandemics that so desperately needed to be raised and brought to the forefront. So as we go through the presentation today, I want to just make sure that we are honoring George and Brianna and Dominique and all of the people that we've lost, because I know that in our movement, we know that there are so many more that have been lost and have been hurt in a system that desperately, desperately needs to be fixed. So we definitely want to hear from you, that we want your questions. And I know that as we go through that, we may not be able to get to all of them, but my commitment is to you and to the people that were here last time. We will definitely go in and answer any questions, and then I will send out a Q&A. So please make sure you put in your questions in the Q&A box. We've got a team that'll be responding if you're raising your hands and things, but we will be answering all the questions at the end. For my entire career, I have worked in the issue of violence against women and girls, and I started out working with abused children, and then later, as Gretchen mentioned, I ran a very large domestic violence center. And what I did when I was involved in that was really start to realize that the way that we were telling the story about domestic violence was not clicking for so many of the people that held the funding, and that we had to be able to tell the story in a different way. And so what I'm about to share with you today is a culmination of really 15 years of work on how do we start shifting and telling the message around domestic violence in a way that people will hear it. And last night for me was very moving because we have seen movements rise before. After Nicole Moran Simpson was murdered, when we saw Ray Rice, for instance, on camera assaulting his then girlfriend. We saw the Me Too movement, for instance, and get a tremendous amount of attention, and then start to slowly be torn apart and not have the momentum now that it had a few years ago. So what I saw last night, though, was when President Obama spoke, I saw him start with one concept, and that was data. And he said, we're going to do this with data, and we're going to do this with evidence-based practices that we know reduce police brutality. And he talked about 8 Can't Wait. And it's a simple concept, but one of the things I wanted to highlight in all of this is that this is what our movement needs. We must get to a point where we can say our goal is to reduce instances of domestic violence by 72%, which is what it says on this. Or our goal is to ensure that every single survivor who reaches out or comes into shelter never has to make the decision between going to the streets or going back to their abuser because they don't have the housing or the economic support they need to get free. And what we don't have is data. And that hurts us. It hurts us because we can't then come out with a unified plan like this, but it also hurts us because we can't tell the story in a unified way. And right now, we're seeing headlines on a daily basis. We're seeing that COVID, we know, is going to increase domestic violence. We know that our best guess is that we're going to see 20% increase. In some places I'm hearing as high as 80%, and in others more around that 20%. So my guess is it's going to be actually higher than that with this secondary wave, especially with people who may be more likely to harm their abusers or their partners, and they're already stressed because they're unemployed. They're stressed because of maybe having lost family members, and drugs and alcohol may have increased during the lockdown. We're seeing this heightened anger and stress, and so we all know that this may actually, in fact, contribute more to the rise of domestic violence than even COVID did. So we have to be prepared for that.
So the heart of what we're going to talk about today, though, is a study that Ari and I did, and we were approached by the shelter, which is a domestic violence program. It's absolutely fabulous that I've been working with for some time in Naples, Florida. They do work in Collier County, so part of their work is actually rural migrant community work, and the other is more in the hub of one of the most wealthy counties in all of the United States. So they have this really diverse population that they have to work with. And what they had originally brought me in to do was to help them with their outcome measures because they wanted to be able to raise more money around prevention services. And then they found the Chanley study. And the Chanley study really looked at how to capture the economic impact of domestic violence services. So I decided that what we should probably do is not just talk about that impact of the domestic violence services, but let's also be able to provide them with the data that they could use to be able to talk about the economic impact of abusers' effect and the advantages of their shelter. So that's what this research study actually developed and evolved into. So why local? Well, we see the national data all the time, and oftentimes when a woman is killed by her abuser, it's inevitable that the media goes to almost always one place, and that's the NCADV website. They pull down some statistics, and that's the statistics that you're going to see running across your screen in your local community. But the problem with that is those numbers are so large. And because they are so large, we typically do not see a how that affects us personally. I mean, yes, okay, so it's billions of dollars that across the nation, but is that in fact something that I should care about in my community, especially if I live in a rural community or a community where maybe we haven't raised a lot of awareness around domestic violence? So we have to be able to bring in numbers that make an impact, that people understand, that they can see that these numbers mean something in their town, in their neighborhood. And we used a variety of tools to be able to do that. And a lot of these tools are actually out there, but knowing that you can actually use them in your local community to tell a different story is important. And so we have links in the research study when you go on charityglobal.com/DV-case study, you can download the report, but and they have the links to every single one of these. The Texas Health Resources was one that we used, and I used to use this tool a lot when I was at Harbor House to work with corporations to talk to them about what is the economic impact on your business. But by using census data, you can actually calculate countywide a lot of different indicators, and that's what we did with that tool. We also used the RAND cost of crime calculator, and we used Florida Department of Law Enforcement data, as well as the United Way Alice report, formulas from the Chanley study, and most importantly, the IRS cost of inflation calculator. The Chanley study was actually 2001 data. The Texas Health Cost Calculator was in 2007 numbers. RAND was in still yet other numbers. So in order to bring them all up to 2018, which was the latest year that we had crime data, we went ahead and used the IRS cost calculator to be able to calculate that information. So we were being able to show apples to apples so that all the data was up in current years. So the first thing that we looked at was we wanted to tell the story about the impact of abusers' violence on the community economically. And we all know that there are a lot of other costs, but what RAND did was in their cost calculator, they wanted to calculate if we added or decreased law enforcement officers, what would that impact be on crime? And so for those of you that happen to be in law enforcement, this is a great thing for you to be able to show, look, if we just added a few more officers, we could actually decrease the amount of crime in our community, and this is how. So especially if you're wanting to build a domestic violence specific law enforcement unit, this could be a really great thing to do. So we only used the data that the Florida Department of Law Enforcement identified as crimes related to domestic violence. And I want to pause here for just a second and point something out. Domestic violence, when we talk about that, we're talking about intimate partner violence. And it doesn't matter who the perpetrator or the victim is, we're talking about intimate partner, either dating, marriage, some sort of relationship that the two individuals have had. But when you go state to state, the criminal definition of domestic violence varies dramatically. And so we have to be really careful when we're talking about domestic violence and we're pulling data from different sources. For instance, in Florida, domestic violence is anyone who is a blood relation, married, or has a child in common. It actually doesn't even involve dating partners. They are covered, but under the statute, the way it's currently written, it might not have all of the people that we would think, but it's also going to have more than you would actually think. So you have to make sure that you're being careful. In Tennessee, for instance, domestic violence statute includes roommates, whether or not they have a relationship, just because they're cohabitating together. So let's make sure, and this is where I go back to what President Obama said last night, we have to be sure that when we're talking about domestic violence and we're talking about increases in crime or decreases in crime, that we really are all talking the same language. If we're talking intimate partner violence, we need to make sure we're talking intimate partner violence. We need to make sure that we're having the same conversation so that we can be legitimate in the data that we're putting out there. So having said that, you can see that we're talking in Collier County, which is not that large of a community, $200 million is what the cost of those crimes, which is less than 2,000 crimes, cost taxpayers on an annual basis. The next thing we did was we started looking at, and this is only a handful of the charts that are in the report, but we used the Texas Health Cost Calculator and we calculated county-wide what was the number of assaults. Now, the Texas Health Calculator only calculates for female survivors. And I know some of you work with male survivors. I know we always do, or transgendered individuals, but that's just how the instrument is set up. You might be able to manipulate the data to identify other populations, but for this study, we just went with the pure cost calculator, which only identifies female survivors who tend to be the ones that are going to suffer injuries. 98% of injuries are women. So the estimated injuries from assaults, and again, small community, we're talking about almost 25,000 injuries a year from domestic violence incidences in this community that are going to require almost 14,000 doctor visits. We also know that when someone is misdiagnosed, oftentimes that doctor visit is costs more. I think the latest research shows somewhere around $1,700 to $2,000 more when a person is misdiagnosed. So the cost of the medical system, we're talking an additional $33 million to the cost of the medical system. And we're going to talk a little bit later on about how to use this data, but you can imagine being able to go to your healthcare system, which tend to have lots of money that they give away to nonprofits, and being able to talk to them about why it's so important for doctors to screen. And that, for me in particular, is a particular passion, trying to get all the doctors to screen the HITS tool. In fact, we created an app, a global app that was in the New England Journal of Medicine, encouraging doctors to screen, because we knew that the impact it would have if every doctor screened at every single appointment. And sometimes getting them to understand the magnitude of the number of patients they might be seeing helps in that argument about why they should screen. So with that, I'm going to turn it over to Ari, who's going to tell you a little bit about herself, but it's been a joy working with her, and she is my on-the-ground guru for pulling the data. So Ari, I'm going to turn it over to you.
Thank you, Carol. So my name is Ariadna Parada, and I'm from El Salvador. So saludos a mi comunidad latina. I would love to hear where all of you guys are from. I know I've been seeing a lot of in the comment section about people from Texas and all over the states. So whoever hasn't said anything, I would love to hear from you too. I'm also an Avengers fanatic, as you can see behind me. And I just want to really say thanks to NCADV for allowing Carol and I to present on our findings on such a large platform. And of course, thank you to Carol for allowing me to work alongside her on such an important issue. Growing up in El Salvador, I never heard of domestic violence as a large social issue. So I also want to hear from you guys if you grew up in a country or a culture that didn't talk about domestic violence. And I also want to say this has been such a growth experience for me. I'm really passionate about social justice and social change, especially in the environment that we're living in right now, that it's so important to be conscious. And so I'm going to start giving a little introduction to what we did. And I'm not going to go into the intricate details of how we got the data, but I am going to do like a little rundown and explain the process and how we obtained it and what the data means. So in summary, we did a cost-benefit analysis that led to a return on investment from the shelter in Naples. And in order to kind of explain that, we first have to explain what the social cost is, right? So the social cost is what money domestic violence survivors and programs are taking out of the community. So in other words, what we can say is, what do survivors need to support themselves, and what taxpayers and donors are paying for those to run those programs. So we kind of came up with 4 components, and those are the emergency shelter, the cost of counseling services, the cost of market rate labor, which also in this section, we also included volunteers, because many times, as we all know, advocates are paid less than market value because they work for nonprofits. And then finally, what we did was we calculated the welfare benefits. And the welfare benefits are what survivors need to stay free from their abusers. And that can entail cash assistance, food stamps, and Medicaid. Carol, thank you. On the other hand, we also went into the social benefits. So the social benefits are all of the positive outcomes that the services from the shelter provides to survivors that then has like a really big impact on the entire community. So what the Chanley study actually highlighted, and what we really want to highlight for you guys today, is that they found that up to 95% of survivors that came into emergency shelters could be protected from future assaults. And why is that data so important? And I think this is kind of tying into what Carol was saying about what Obama was saying yesterday, is that we need to run with the data. And I think that it's so important when we're talking about going in front of donors and pitching ideas and pitching the fact that we need money for our nonprofits or organizations, and bringing in the data is going to provide a more detailed, persuasive argument to the table. Like as Carol was talking about in the abuser's violence, and how one cost of aggravated assault is around $98,000, and how there were around 14,000 required medical visits because of domestic violence caused, and that out of those, there was 25,000 injuries in that same year. And then you saying to a donor, hey, we had 14,000 medical visits and we had 25,000 injuries related to domestic violence. And what we can tell you is that 95% of survivors coming into our emergency shelters will be protected from those assaults. it just makes the argument so much more powerful that it'll definitely be beneficial to you. And also on top of that, we estimated the social benefit of providing economic stability to survivors so that they wouldn't have to go back to their abusers or become homeless. And then finally, what we did was we calculated the social benefit of the shelter providing mental health counseling to their survivors. Carol, if you could go to next, thank you. And then what the final calculation that we did was the return on investment, or the ROI. And the Chanley study used a lot of data and used a lot of studies to come up with the social benefits and social costs. But I won't go into like the nitty gritty of like how we got those specific formulas, but I am just gonna simplify it and just basically say that what we did was we grabbed all of the total benefits and we divided that by the total cost, and that's how we obtained the ROI. In the Chanley study specifically, what they did was that they were able to determine a conservative estimate, which they called the lower estimate, sorry. And they were also able to determine a less conservative and a little bit more aggressive estimate, which is the upper estimate. And, you know, like depending on how you use the data, you can either be conservative and use the lower estimate, or you can be aggressive and use the upper estimate. Or, you know, you can just shoot two birds with one stone and do an average. But either way, it's just important to understand that you have a range of data and that you can use that data however you see fit. So for the ROI calculation, and again, this is oversimplifying it, we took the social benefit of the shelter, which was a little over 7 million, and the social cost was a little bit over 7 million, and the social benefit was nearly 13 million. And then for the upper estimate, they had a social benefit of little over 52 million and a social cost of 7.5 million. So the upper ROI was $2 and the lower estimate of the ROI was 7. So the average ROI of 2 and 7 was $4.40. And another way to consider that is that for every dollar invested with the shelter for combating domestic violence in Collier County, taxpayers save an average of $4.40. And we have to take into account that the shelter operates with a $5 million budget. And to be able to say, hey, we run on a $5 million budget, but we provide a social benefit to the community of over $52 million, that is so powerful, and it brings so much to the table that using the data and using it locally will really benefit you when you are pitching. Thank you. And I'll hand it back to you, Carol.
Great. So thank you, Ari. Using the data is really important because you don't want this just to be a report on a shelf. You want to make sure, and hopefully my audio is working good. You want to make sure that you are, hopefully you can all see me. But let me try to do this, stop and start my video again. One of the things that we want to make sure that we're doing is using this data so that you can start to do some more social change work in your community. And you might be tempted when you see the report that we did, just to send it out like that. And that's okay, but really in this shifting philanthropic environment, you have to really start to think about your audience and who is the person, what is most meaningful to that person that you're talking to right then and there. So every audience is going to have a different type of message that they want to hear. And I always say to the folks that I'm working with, it's hard but then you have to bring the head piece in, and somewhere is an intersection between the two of those, and that's where you have that sweet spot. So I know for some folks, you know, just calculating an economic impact is kind of counter to what they're used to, but we have to realize that most of the people that we're talking to are business people, and those are the people that we need to invest so that we can do more work. And you can actually reach more survivors because they're going to open up their systems to be able to let you come in and do the work. And I know when I was at Harbor House, we went from serving about 3,000 people a year to the year I left, we served about 11,000 survivors a year. I knew we had so many more than we thought we did, but by getting in and opening up and having people refer them for help, we knew we were saving lives. And the year I left, we'd actually eliminated domestic violence homicides in the city of Orlando. So that's where we all want to get. So you can use this for social change. You can explain impact in different ways. And you can use it for fundraising. And I want to show you one of the ways that we use this information in the report that we did for the shelter. And this is one of the infographics that we did for them. So oftentimes when I see impact reports, especially from domestic violence programs, they use what's in that first box, and they use that exclusively. And that is the number of hours of counseling that you provided, or the number of people that you sheltered, maybe the number of safety plans or hotline calls or injunctions. And what you're doing there is you're actually talking about outputs, not outcomes. Outputs are anything you can count on your fingers. So if your outputs are all you're talking about, you're not telling people about how your organization transforms lives and has an impact on the community. So we did this kind of juxtaposition for this particular document because what we wanted to do is be able to say, look, they provided almost 24,000 hours of counseling, which saves taxpayers $120,000 a year. I mean, that's a tremendous impact. They reduced injuries by 95%. And they provided a benefit to the community. We use the upper estimates for this of $52 million a year. So for every dollar that was invested, they returned 7 back to the community. And again, it's not that we don't want to also add a story about a survivor with this, but this is going to be catching a lot of people's attention who are also looking to make sure that they're investing their dollars well. And we know that there are fewer dollars out there, so you have to be sending this message if you're going to be competitive and the funding that's going to be available. This is another tool that we used when I was at Harbor House, and we did an interactive map on the internet, and we had our local university use a GIS, which is the tool, but you can actually use Excel with this now, and then you can work with a web designer to make it interactive with little pop-ups. But we wanted people to understand that just because a community had lots of 911 calls didn't mean domestic violence wasn't happening in other areas. And we all know, because we've been in this movement, that we see a lot more domestic violence 911 calls and child abuse calls in areas where there's high poverty. But we tend to not see them in the gated communities. So if you're only relying on the data that comes from those two sources, you're not really telling the big picture, which is something that we as advocates say all the time, that this happens in every home and it doesn't matter what the socioeconomic status is. So what we did, we overlaid people who sought injunctions, outreach, called through the hotline, friends and family who called. We even overlaid an animal abuse when we were looking at raising money for a domestic violence kennel at our shelter. And being able to do that, people could go in, they could click on their community, and then this became real for them, because then it was their neighbors. Then it was like, suddenly it was the person who was in their Bible study group. And we were able to start engaging them and going to trainings and learning what to do if they recognized the warning signs and how they could help a survivor get the services that they needed. The next thing is a little, I wanted to tell you really about how I shifted telling the story from what I think a lot of people use. And this is, I used this in 2013. So this is it kind of dates me a little bit here, but I was very frustrated because our local government refused to give us more money. And so I thought, well, hey, I've got some clever data here. I'm going to show them how in the blue line, we were seeing very consistent increases in the number of people we were serving every single year. And their money had either stayed fairly even or even decreased in some years, even though we were seeing increases in the number of survivors. And guess what they told me when I went in and did this presentation? They told me they were so grateful that I was being a good steward of their government tax dollars, and that it was great to see that I was making the money stretch as far as I possibly could. And I got nothing. So I went back to the drawing board, and this is when I started on my quest to start really trying to tell the story differently. And so the next year I came back with this. Now this is just impact. This is not the impact that our programs had, the ROI piece of it, but this is the impact of the abusers. And what I did here is we had 2 mass murders that year in Orange County. We had 27 people that were murdered, and we had, you could see we had 8,500 911 calls. So I went about finding out how much each one of these costs, finding out about our child abuse investigations where family violence threatens the child, which is the domestic violence code here in Florida, and how many kids ended up being put in foster care because the home was no longer safe. And so I was able to show that that year, $24 million was spent on just not fixing the problem. We were obviously spending tens of millions of dollars and still having mass murders in our community. And we had to start doing something different. They gave us our own line item and $300,000 in funding, which doubled the amount of funding that we had. Not to mention we started getting other people to start coming in on the issue as well. So you can imagine how you can start using this data. You can take the domestic violence cost calculator. I used to take that with me every single time I met with a corporate donor, and I would calculate for their company how they could use that how many employees they potentially were being affected by domestic violence, and why they needed to change their policies and procedures. So the data changes the conversation. It's not just about the passion plea, because let's face it, most of us, before we got into this movement, didn't really understand the issue. At least I know I didn't personally. I had been working with women and girls my entire career, and it was about 6 months into running a domestic violence program that I had a wake-up moment and said, okay, now I got it. And so we have to help people understand in the ways that they need to hear, and a lot of times that means the data. So we want you to download the report, and my commitment to you is this is always going to be free on our website. You can go in, download the report, and I am going to be putting up little videos to show you exactly how to calculate some of this data so that you can do this on your own. My goal and my passion is to empower you to be able to tell your stories, to be able to get the funding that you need to do the work that you're doing that is so critical in the communities that you serve, and to be able to do some social change work, to be able to start to have better outcome data and better conversations with the people in your community, and to have them kind of perk up because they understand why it means so much. On our website, you know, I've been in the nonprofit field for 30 some odd years, and so my passion is helping nonprofits build their capacity. So we have a bunch of other quizzes and things that you can take that actually produce reports that will help you understand what major donors are looking for before they make a major investment. We know that galas and the fundraising events and things like that are starting to wane, and we don't know when they're going to come back. So it's really important that you be prepared, that if someone is thinking about making a major donor gift, that your organization has the things that they're going to be looking for. And this assessment will help you do that. There's absolutely no reason to pay a consultant to do a development assessment or feasibility study. You know, this will actually tell you a lot of the same information.
So with that, we'll hop into questions. So Gretchen, anybody, if you have questions, put them in the Q&A, I believe, right?
Yes, thank you. We do have one question from Alicia. She says, what databases do you recommend that are user-friendly for staff? She wants more data, but she has concerns about putting too much of a burden on frontline staff doing work.
Yeah, you know, there are several different databases out there, and that is, I have to tell you, not my area of expertise in terms of CRMs, client management databases. Having been out of that piece of it for several years, I'm sure there's probably some folks that could throw in the Q&A and maybe answer that question for you, but we can, I'm sure. And Gretchen, do you have any thoughts on that?
No, honestly, it's hard for us to determine. We have a lot of companies that approach us wanting to market their information, but ones that are really good, I don't know. Someone here is saying 211counts.org is a national database for social services that are requested. If there are any other people on the webinar that have ideas, please share them via the chat or the Q&A.
Yeah, and I think that actually is a resource that gives you places to refer people. But I think what she was asking is a database, like a client data management system, right?
Okay, yeah, yeah.
I would recommend, I know that there are a couple different coalitions that have databases that they use statewide. So I would really recommend maybe reaching out and asking your coalition if they could reach out to the other coalitions and find out what are the good ones and what are the bad ones, because a bad database will make your life miserable.
Absolutely. Okay. We don't have any other questions at the moment. We'll give people just a few minutes to take a and see if they have any questions that they'd like Carol to answer.
Yeah, we'll be sending out the PowerPoint, and hopefully there'll be you know, some opportunities if you have some. Oh, somebody says they use VS tracking. You know, to answer any questions you may have, we have some specific ones. We didn't really get into the complicated calculations because it gets kind of complicated, but we certainly we'll be providing you with how to do some of those via some of these little short videos, especially if there's something that you're particularly interested in.
Great, let's see. We have a couple of questions coming in.
Okay.
So Allison asks, as far as funding for this research project, can you address how you obtained funding?
Well, we were the contractor that did this for the shelter. So they had a private donor that paid for this. They also have a very large thrift store that helps quite a bit with their funding. I would say, you know, one of the nice things is you can download the report. And what we did was, as our gift back to the shelter, we had our graphic designer create that report. Also, we wanted something a little bit prettier to be able to send out to you all. You could take a copy of that report and say, we want to do this here locally. And you know, feel free to give us a call if you want some help with that. We can produce those fairly inexpensively because we have the formulas. We've done it now. It took us a long time to figure out all the moving parts of it to get it right. So, and our graphic designer is very dedicated to this issue. And so she's also willing to give discounts to anybody who might be interested.
Great. Okay. Let's see. Maria asks, you might have already said this, but I'm in academia and was wondering how we can get local data on rates of domestic violence from 2020 to determine if rates are indeed increasing locally. Would I just contact the police department?
So law enforcement data typically lags anywhere from 6 months to a year behind, which is why we were doing 2018 data for the shelter. you have to call your local law enforcement. They have to have that data, and usually, I'll give you a little bit of a trick. They have someone that all they do is data collection. So ask to speak to the person that does their, that sends their data to the State Department of Law Enforcement. In Florida, that's the Florida Department of Law Enforcement, but each state has their own place that then pushes their data to the Department of Justice. And then there's a national database. So definitely ask for that. But also, again, if you're collecting data from the police department, make sure you're very clear about what you're looking for. And if you need to tease out non-intimate partner violence, typically police departments track whether or not the crime was committed in the relationship. I know our state attorney's office for years didn't track the relationship, and so we were having to hand calculate the data, which was a nightmare. So make sure that you're doing that.
I just want to share a comment, just to acknowledge it. Nabat states that it's not safe for everyone to call police, and so there may be many things going unreported. And she's certainly not saying that it's wrong to call the police or not call the police, but just wanted to acknowledge that the data may not be completely accurate because not everyone's reporting. So
right, and that's my point with the heat map. That's why the heat maps are so critically important, because you can show the layered data, and you can show how in some areas people are calling the hotline, or they're coming into shelter, or they're just going in and getting an injunction, but they're not calling 911. So it's really important to give a holistic picture of what's happening in your community. And by doing it by zip code, you're not endangering anybody. I know that some law enforcement agencies actually do address or street level data, and I don't care for that. But you can get that data and then again layer other types of data on top of it, and it gives a much richer picture of what's going on.
Great. So there are a few more questions. April asks, how do you make a heat map? And once you address that, I'll ask the other question.
So heat maps can be done on Excel, which is great. They are, Excel has just become so much better and has so many more tools, and you can actually go in and it will take the data in a grid and create a heat map for you. If you want to make it interactive on the internet, you'll probably need someone or there may be an add-in that you can do. I'm not as savvy with the internet piece of it, design piece of it, but that's a great way to do it really inexpensively is with Excel.
Great. Okay, so Alexandra asks, do you know of any research or ways to calculate the ROI for rehousing IPV survivors?
Right, so that's actually somewhat in the data that we have, and we only presented a piece of the data that's in the report. The one thing that Chanley found was that 25% of survivors end up only 25% end up successfully escaping their abuser and getting free. 75% either end up back with their abuser or end up homeless. So again, that's a really horrific, statistic if you think about it. We want that to be much better, at least flip the other way. And there's some data around that. So I really encourage you to take a look at that, to take a look at the Chanley study, as well as to take a look at the study that we did with some of the numbers. And Ari, do you have anything else you want to add with that?
No, just also highlighting the fact that Chanley also said that 95% of all survivors going to the emergency shelters can avoid assaults. And I think that it's really important what you said about the 25 versus 75%. And there's a lot more data, a lot more percentages in the Chanley study and in our study as well that you guys can look up with those facts.
So someone here shares a point that I think is just kind of an interesting point. Barbara says there's a potential downside of heat maps, especially when it overlays low-income communities. She says we find that while DV impacts all socioeconomic strata, those with fewer resources run out of resources dealing with the DV sooner and come to us or law enforcement sooner. So just FYI, I thought that was an interesting point. Okay, so a few more questions are coming in. Nikki says that they do legal representation for victims, so like family law protection orders and immigration. Do you have any data about the ROI of having an attorney to pursue legal action?
You mean the value, like the value of an attorney? We didn't have that. That's not part of this study.
You can definitely,
yeah,
you can definitely determine it. I think just looking at how much an attorney costs per hour or by the service, and then add that into the social benefits of providing attorney services to victims or survivors.
that is one of the advantages of what we did, is that it is possible to adapt it beyond what we did for this initial study and add other social benefits and social costs, because we know how to run the calculations. So, you know, we could potentially do that for you or show you how to do it.
Excellent.
Somebody did ask how you can get the copy of the Chanley study. In the report, there's a hyperlink to every single resource that we used. So it will take you onto the web so you can find it.
It's very easy to navigate.
Excellent. Okay, so Alan says that he works in the field of prevention in a law enforcement agency. After sharing the data of the cost of DV, IPV to the public, businesses, etc., is there any measurable data to show more reporting of IPV or DV?
Well, I mean, again, you can use that heat mapping, and we used to do year over year, and we would also break out the heat maps by type of reporting. So the thing is, you have to do it holistically, right? You just can't talk about 911 calls unless the goal, again, the outcome that you're looking for is that people will trust law enforcement more, and so therefore they'll report more. Or you're doing, say, a community engagement project, and that community engagement project's designed to get people, if they hear violence, to call 911. So, you know, think about what you want your outcome measures to be, but then that heat map needs to be layered and needs to show all the different components of how people could report, including hopefully doctors.
Excellent. Okay. Well, it looks like all the questions have been answered, and the chat box seems to have quieted down a little.
Yeah.
All right.
You know, if you're out there on Facebook land, feel free to add any questions you may have as well.
Oh, here's one. I'm so sorry. Let's see. So one of the Facebook attendees is asking, what can I do about harassment with the justice system? Who do I need to reach out to? Actually, she may be looking for a direct help.
Okay. All right.
So Nicole, I'll follow up with you offline. I can help. And there's people already suggesting resources for her. Excellent.
Good. Well, and we want to make sure that, you know, in terms of the study, we want to make sure we're giving you as many free resources. I have been where you are. I know what it's like to reuse the foam board from a special event and flip it over and use it as a bulletin board for the kids' classroom. Because we didn't have enough money for bulletin boards. So I know what it's like. I know what it's like to be, you know, get ready to have your monitoring and you're out there scrubbing until 3 o'clock in the morning. So we want to do everything we can. That's what the foundation of my company is built on, is to help you be able to do this yourselves and not have to spend more money paying someone else to help you. So as much as we can help you do this yourselves, we want to definitely do that.
Excellent. Okay, well, that looks like all the questions that have come through. Carol, if you wouldn't mind moving to the last slide, I can
Absolutely
finish up with my housekeeping. All right, so wonderful. Everyone, thank you so much for being with us today, both via the webinar and then also on Facebook Live. For those of you on the webinar, you'll be prompted to complete a short survey. Please take a minute to fill that out. We certainly listen to your feedback and we take direction from you. Again, we will be sending an email to you within 2 days of this webinar that includes a recording of this session, a certificate of attendance, and then links to other additional resources. So again, thank you so much. Watch NCADV's email and website for developing webinars. We're kind of putting them out there as they come to us these days. So we appreciate all of you. Thanks so much and have a great day.
Thank you, everyone.
Thank you, everyone.